In this lecture, we are going to discuss different aspects of the clindamycins, like the administrations of the clindamycin, mechanism of action, antimicrobial spectrum, and the different adverse effects of the clindamycin. So let's get started. First of all, clindamycin is actually belong to the most important antibiotic class, that is the lincosamide. So in the lincosamide antibiotic class, you will see the two most important antibiotic. First one is the lincomycin and second one is the clindamycin. Okay. And don't get confused with the macrolides as we have discussed in the previous lectures. Okay. If we look at the administration, so clindamycin is basically administered through the parenteral route, okay, and it can also be given through the oral route as well. So most important routes, you will see the parenteral, or you can say IV route. It can be given through the oral route and it can be applied topically. So there are basically the different routes of administrations of the clindamycin. So most importantly, clindamycin distributes very well in the body. But important thing which you have to remember, you will see the poor absorptions of the clindamycin in the CSF, cerebrospinal fluid. Here is the poor absorption of the clindamycin into the CSF. If we look at the mechanism, how clindamycin actually inhibit the protein synthesis. When you see the inhibition of the protein synthesis, then you will see the bacteriostatic effect of the clindamycin. So in the bacteria, you will see the two most important subunit of the ribosome. First one is the 50S bacterial ribosome and second one is the 30S. Okay, here is the 30S bacterial ribosome, and in between them you will see the presence of the messenger RNA. So here is basically the initiation complex of the translation process. So basically you will see in the central dogma process, you will see from the DNA synthesis of the messenger RNA, and from the messenger RNA you will see synthesis of the proteins. Okay, first step, synthesis of the messenger RNA from the DNA, is actually called the transcription process. Okay, and second step, synthesis of the protein from the messenger RNA is basically called the translation process. So clindamycin basically play its role in the translation process. We will see how. So in the messenger RNA, you will see the three most important site: E site, P site, and the A site. Okay, this one is the exit site, peptidyl site, and the acceptor site. Okay, first of all, transfer RNA having amino acid will bind at the P site. Okay, first of all, we will look at the normal process or the normal mechanism of the translation. Then we will see how clindamycin play its role in the inhibitions of the protein synthesis. Okay, so first of all, here is the transfer RNA. Okay, and you will see the association of the amino acid with the transfer RNA. Here is the amino acid that actually bind with the transfer RNA. Okay, similarly, next transfer RNA having different amino acid, here is the amino acid, will bind at the A side, acceptor side, and after that you will see there is a bond formations between the two different amino acid, and ultimately this process carries out. Previous transfer RNA will exit at from the E side, exit side, and the new transfer RNA will come at the A side. This is the normal process that actually happens in the translation process. Now, when someone take the clindamycin, so basically clindamycin first of all enter into the bacteria, and after entering into the bacteria, it will bind with the 50S ribosomal unit. Okay, here is the clindamycin. Okay, okay. After binding of the clindamycin with the 50S ribosomal unit, it actually do two things. First is actually inhibit the translocation process. Here is the translocation of the transfer RNA from the A side to the E side. That is the one thing. And second most important thing which you have to remember, it actually blocks the peptide bond formation. It actually inhibits the formations of the bond between the different amino acid. When there is no bond formation between the different amino acid, then you will never see the protein formations, because as we know that the lot of different amino acid combine, and ultimately you will see the formations of the proteins. When there is no linkage between the different amino acids, then there is no protein formation in that case. Okay, so here is the most important mechanism of the clindamycin: inhibits the translocation and also actually block the bond formation between the different amino acids. If we look at the resistance, so most importantly you will see the decreased uptake. When you see the decreased uptake of the clindamycin into the bacteria, then there will be no effect of the clindamycin inside the bacteria. And you can also see the efflux pump. Efflux pump, bacteria can expel the clindamycin from its cell. So that is the important thing. When there is no clindamycin inside the bacteria, then there will be no effect of the clindamycin in that case. Okay. Similarly, you will see the modification in the binding site. If the bacteria develop modification in the 50S subunit by methylation process, then the clindamycin can't bind to the 50S ribosomal unit. When you see there is no binding of the clindamycin, then there will be no effect of the clindamycin at that site. Okay. And you can also see the different enzymes that actually inactivate the clindamycin. Here are basically the different resistance mechanism that actually bacteria develop against the clindamycin. Next, we will look at the metabolism of the clindamycin. So basically, you will see the oxidative metabolism of the clindamycin inside our liver. So most importantly, you will see clindamycin actually metabolized inside the liver, and you can see the active, okay, or you can say the inactive products, or you can say metabolites of the clindamycin. And ultimately these metabolites excrete from our body through two pathways. First, clindamycin can be eliminated through the bile and through the urine. Here are basically the two most important excretion route of the clindamycin, through the bile and through the urine. But if there is a defect in the liver or the kidney, then you see the accumulation of the clindamycin inside our body. Like if the patient is facing the liver dysfunction, then you can see the accumulation of the clindamycin in that patient. If the patient is facing the renal impairment, then that patient can also see the accumulations of the clindamycin in his or her body. Next, if we look at the spectrum, so most importantly, it is good for the gram-positive bacteria like the streptococcus and the staphylococcus. Most importantly, streptococcus and staphylococcus. And most importantly, in the staphylococcus, you will see the MRSA, methicillin resistant Staphylococcus aureus. That is the important spectrum, antimicrobial spectrum of the clindamycin. Okay, clindamycin is also good for the anaerobes and aerobes, both positive and the negative bacteria. In the positive, you will see the C. perfringens, Clostridium perfringens. Okay, and in the negative case, you will see the Bacteroides fragilis. So here are basically the different is antimicrobial spectrum of the clindamycin. So clindamycin can also be used for the fungus, and that is the pneumocystis jirovecii. So here is the most important fungus, and clindamycin can also be used for the AIDS-related toxoplasmosis. In that case, clindamycin will be given along with the pyrimethamine. Okay. If we look at the different adverse effects, so most important adverse effects related to the clindamycin is the skin rash. Okay, that is the important thing. Next adverse effects, you will see the neutropenia. neutropenia. Okay, low count of the neutrophil in that case, and you can check the neutrophil through the CBC report. In the CBC you will see the low neutrophil count of the patient. Okay, and you can also see the GIT disturbance, like the in that case you can see the nausea, vomiting and the diarrhea. So nausea, vomiting and the diarrhea, so here are basically the important GIT disturbance in that case. And last, most important, that is the pseudomembranous colitis. Okay, pseudo pseudomembranous colitis. So basically, when the patient take the clindamycin, so by taking the clindamycin actually inhabit the normal flora of the intestine. Okay, if I say here is the presence of the normal flora in the intestine, if the patient takes the clindamycin, then the clindamycin actually inhabit or destroy the normal flora of our intestine. Okay, and ultimately due to the inhibition of the normal flora that is good for us, after that you will see there is a place where can dangerous bacteria can attach at that site, like the C difficile, Clostridium difficile. Okay, so in that case, after finding place in the intestine, C difficile bind in the intestine and cause the pseudomembranous colitis, and ultimately you can see the diarrhea in that case. So there is a formation of the false membrane in the intestine due to the C difficile, and C difficile is basically resistance to the clindamycin. And similarly, a lot of different drugs can do the pseudomembranous colitis by inhibiting the normal flora and promoting the overgrowth of the C. difficile. And basically, the difficile is actually inhabited or destroyed by the oral vancomycin or metronidazole. So this is all about the clindamycin. If you still have any question, you may ask in the comment section. Thank you so much.